Welcome to Money Mondays. This is Ezekiel Olande coming to you live from Icon Radio. We are very happy to have you join us this evening, and we're having a very interesting conversation. My guest is Minister Radak Sammy, and Radak is a business development executive, and we are here to discuss matters health. And we're just going to have a really candid conversation about our healthcare systems and the business around that. And before we delve into the conversation, Radak, please introduce yourself. Tell us who you are. Tell us what you do, and tell us a little bit about yourself. Then you can proceed. And why are we calling you minister? We're any CS Mahali? Please. Explain yourself.
It's funny how after such an introduction you want me to also introduce myself, but of course I'll go ahead and introduce myself.
Yeah.
My name is Radak Sammy. Actually Sammy Okoth Radak, but I call myself Radak Sammy. The name minister came to me while I was back in campus.
Yeah.
It's just a name that I think it was like a brand, because the way people were seeing, the way I used to operate, and this name even gave me an identity, because, the way I used to see things, because minister has a lot of different meanings, which maybe we'll have a different time to talk about.
Yes.
But today we are here to talk about some of the most crucial matters, that are affecting not just Kenya, but even Africa and the world.
Yeah.
Healthcare, business, and governance.
Yeah.
So I am affiliated to healthcare by the virtue of the fact that I'm a medical laboratory scientist by profession.
Okay.
I did that in Jomo Kenyatta University. But then after that, I kind of jumped into a different field of business development.
Yes.
Right now doing business development for a diagnostic center, ultra diagnostic center located in Kilimani Adams Arcade.
Yeah.
Yes. And I'm happy to be here, Ezekiel.
Yeah.
I don't want to mention our, long story of background where we met, but of course we'll be able to catch on that as we move on.
Yes.
Thank you.
And as Radaka said, we know each other from a different, should I say, life. I met Radak when he was undergoing training in democracy school. So he's a governance enthusiast. I want to say he's a political animal as well. And so he's a very smart and sharp guy, and I'm very happy that we get to have this conversation. We have looked for an opportunity to sit and talk matters health and other things as well that we will weave into our conversation. But for the purposes of those who are taking notes, I'm kidding. Our topic of the day is Healthy Systems 360, healthcare, business, and governance. And, we just want to explore this theme and see how healthcare moves just beyond hospitals. It shapes our productivity, drives the economy, tests the effectiveness of governance systems, and we don't even have to talk about it. We see what's happening today in the media, and we are here to discuss how to build stronger and more resilient systems that serve individuals, families, businesses, and the nation. But Radak, before we get into the meat of the conversation, tell us a bit about yourself. Like, what do you like to do when you're not doing business development, maneno za siasa na governance, just so that our viewers can get to see, who the person is behind the chair. Yeah.
All right. So, wow, these are very personal questions, but it's good because sometimes that is some of the, qualities that we need to see in a man. You know, what they do beside what they appear to do.
Yes.
So, my life has taken some kind of flip for some time.
Yeah.
Previously, before this, I actually would say I really loved entertainment. Sometimes, I loved going, clubbing and something.
Yeah.
I loved hanging out with friends. And then last year, a shift happened in my life, where I met Islam. And for now, Islam has taken, a lot of my life.
Okay.
And right now, everything I love doing behind the tent is just embrace, the different aspects of Islam, including, seeking knowledge, reading, interacting with both the Quran and the Bible, because that is what Islam teaches. I love interacting with books, of course, authored by different people. I love interacting with the Sunnah of the Prophet. That's a book written by a book of the story of the Prophet Muhammad, peace be upon him.
Okay.
I love, connecting with nature, connecting with things that bring me closer with God. Going to, hiking, going to, seeing rivers, doing walks that connect me to nature. That is what I love doing in the background, apart from analyzing politics and all this. But I also love reading so much. Reading, yes.
Good stuff.
And also playing chess. So love playing chess.
Okay. Hapo kwa chess utanifunza. Mimi nacheza, umejua drafts.
Draft. I don't know about draft. It can be a back and forth. But
you new generation. You call it checkers. Ile unaweka bottle tops and then
is the same thing you're talking about?
Yes, you see now. Like, Jaggy, stop laughing. It is called drafts. Anyone who's my age and older knows it as drafts. At checkers. What is checkers? Anyway, that is good. I'm again very excited to have you here, and I think we'll just delve into our conversation today, talking about healthcare 360, and trying to figure out how to build better, resilient healthcare systems that will last. So, excuse me. Maybe the first question is, how does the state of healthcare influence business productivity and national competitiveness, in your opinion?
All right, and thank you so much for this. And when you talk about healthy systems, and I love the fact that you chose such a topic, healthy systems.
Yeah.
So it's not just about having systems, but it's about having healthy systems.
Healthy systems, exactly.
And we will also talk about systems a little bit, because we need to also have a light of the systems that we have in the country and even in the world. So the systems, it affects businesses. Let me tell you something, for instance. Let me say, if today you were not in correct health, you wouldn't be here.
Absolutely.
And sometimes we look at health as just not having malaria, the known infections.
Yes.
But sometimes health is also security,
I like that.
So where, for instance, you have confidence, full confidence. And by the way, I would love to say something, that when you have food in your house, sometimes you don't even get hungry. But when you don't have it, you starve, brother. You starve.
Yes.
So there is a kind of security you have when you know that everything is in control. So when you have healthy systems, for instance, you know very well that if in case I have a headache or something, I'm very sure that my insurance is going to pay for that. I'm very sure that you won't even get sick. And also above that. When you are not in a correct state of health, and that is why nowadays you've seen different health corporations doing health wellness for their staff.
Yes.
Because it's very crucial to have people who are are very comfortable in their mind, are very comfortable in their space, are very comfortable with their health. You'll be having people who can easily run tasks the way they need to be.
Supposed to.
So it affects business, because now productivity, it's directly related to your health, your health. So, and it also affects, broader everything that we do. Our health affects all that. And that's why they say health is wealth.
Is wealth.
Yeah.
I couldn't agree more, Radak, because, and I like what you have brought about the wellness, because I think for the longest time we were focusing on curative healthcare systems, where ukiwa mgonjwa and hospitali. But we really ignored the preventative, and that's, I think, that's where wellness comes in, where we have conversations way in advance. This is what you need to do if you're working from Monday to Friday, 8 to God knows what time, na kazi yako tu ni kukaa kwa computer all the time. There's carpal tunnel that can happen if you're not using ergonomic seats and working, and even just the idea of having a very sedentary life. you know, we are given to, and more so because post-COVID, a lot of people are working from home.
Yeah.
Unaamka, your commute is between your bed and your chair. Na chakula jikoni ni pale, you know.
So sad,
So you're
yeah.
not moving, as opposed to if you're going to work, you know, leaving and going. So you leave, you commute, you walk, at lunchtime you go. You know, there's a bit of movement that is
Yes.
involved. So I do agree with you. When we don't take our health properly, productivity goes down
Does.
because sick-offs, your premium insurance inapanda juu pole. So yes, I am liking how your your approach to this. So my next question, and feel free to chime in at any point. So, what are the hidden costs when health systems fail individuals and families? What are these hidden costs that we'll find?
This is different because now with costs, they are, and I would love to bring in a quote here that I usually think about in my mind.
Yeah.
About habits. If you do not brush your teeth for a day, nothing will happen.
Yes.
If you don't brush your teeth for 2 days, 3 days, nothing will happen. You'll feel a little bit but nothing will, even a week, nothing
but the
so
people
much
around
will
you will feel things.
But people around you will feel them. And
Yes.
trust you me, with the time,
Yes.
you are going to also feel it.
Yeah, absolutely.
In 1 to 3 months, you are going to be uncomfortable around yourself.
Yeah.
So this is to say that, for instance, in terms of the finances, you cannot see a very big loss in terms of finances when you look at it from the small perspective.
Yes,
of course, I would
yes.
love to say, the different aspects, how the financial cost is the fact that, if you focus on treatment,
Yes.
preventive, it's usually easier. But after a problem has occurred in your body,
Yeah.
it's going to be high in finances because remember, there is someone whose business is
Yes.
to treat.
Yes.
So the moment you get sick, you have given someone employment.
Yes.
So so you see,
Yeah.
when you prevent yourself from getting sick,
Yeah.
at least you can say that at least you'll just pay for the maybe you need maybe some different foods.
Yes,
Of course,
yes.
some healthy foods sometimes cost more or
Yeah.
something.
Yeah.
But then you have saved more than
lot.
you would have spent if,
Yes.
for instance,
You're
you
not
go to
eating
employ
healthily.
someone
Yes.
now. All right. And then also another thing, now the health systems, this is now health of a person.
Yeah.
Now the health system, this now goes bigger to organizations
Yeah.
or even to government. Because now the health system, you'll be losing money
Yeah.
in different ways. So for instance, for the business, you'll be losing money because now people are calling in sick, and now you have to replace them
Yes.
by paying someone to do their work.
Yeah. Or productivity goes low until mtu akuje.
Yes,
Especially
exactly.
if it's someone that you're
Yes.
relying upon. Yeah.
Exactly. And if you calculate these people getting sick, if you calculate it the way you were saying it,
Yes.
once is not bad, but if you
Yes.
calculate it for a 1 year
Cumulatively.
period,
Yes.
now
It
you've
becomes a big
underwent a
deal.
loss. And then for government, this is even big because if you don't have good systems, you'll be having people who are looking for those loopholes
Yes.
to steal money, to take away money from this. So let's, for instance, if you go to I know we are going to talk about this, but if you go to the system of healthcare financing, for instance, right now in Kenya.
mapema bwana. You haven't even left the runway na umesha nini sawa, let's
But
go.
then it is them who are forcing us to
Yes.
having this conversation.
Absolutely.
Because now you see, if you don't have well laid down systems, there are people who are open there to loot money from there. So there is a direct financial loss to that. Yeah.
Agreed. We don't see these things on the immediate, but like you're saying, when we don't take care of the systems, or even just first of your own health, don't eat properly, don't exercise, don't do regular checks. And someone made a very good correlation here. Ukiwa na gari, okay?
Yes.
After a couple of kilometers unaipeleka service.
Yes.
And if you fail to take it for service, eventually it's going to break down.
Yes,
okay?
it will.
This is a mechanical equipment, okay?
Yeah.
Even the equipment that we have here, after some time, we'll always get someone to come and do what we call preventative maintenance. Okay, you come, you check. Hata kama ni vumbi tu, you remove, because it will eventually hinder how things work.
That's why you have a very beautiful place.
Hala boy. However, when it comes to our bodies, what do we do? We are just on the run until something brings you down. Yeah. And then that is when now you do this. And if you could have taken time to do preventative maintenance, if I can call it that, of your own system, then you avoid having this really big health costs when you need to now go down and get checked. So agreed. We need to think and do the piecemeal, so that you don't break down. You don't break down eventually.
And it's really beautiful because, for instance, you can't. They usually say you can't have the pie and eat it too.
Eat it, yes.
So after you've eaten the pie, it's gone. I mean, every action has a repercussion.
Yes.
And that's why when you eat, you have to excrete.
Absolutely.
And when you build a house, you have to renovate it. We always see, State House being renovated, and people question, hey, man, are you guys are renovating this? Because it's very important for the renovations to happen.
Yes.
You need to keep, leveling up
Absolutely.
your health and your systems.
Yeah.
Because we are talking health and we're also talking about the systems.
The systems. Yeah.
The systems also needs to be leveled up. And number one should be, for instance, in terms of security of these systems.
Yes.
For instance, you have let me say you have a system of working, of the people working in your organization. It has to be renewed every day by people recording absence and presence. And presence.
Yeah.
If you just believe that people will come and go, you're going to crumble.
Things won't work.
Yeah.
Absolutely. And you've already touched a bit on this, but maybe let's jump into the governance of health, and probably to ask you, what governance gaps do you see as the biggest barriers to accessible healthcare? Tuanze na Kenya and then in Africa.
Yeah. This makes me even a little bit sad, because we are having this conversation after a big scandal has happened in the country. And sometimes I get really frustrated seeing such things happening.
Yeah.
And you can sit down. For instance, you are a leader, because we are talking about governance. The government sits down with the very high paid, advisors and all this. They come up with a plan.
Yeah.
They say that this plan, for instance, of healthcare, this is what now is going to help. This person that we have put in this sector, this is the one who is going to get the things done. And then at the end of the day, you find that it's not really because they're really trying to create a change or to create impact, but you find that there's strategic interest. So number one, this is a very big problem.
Yeah.
Leadership, not because of impact, but because of strategic interest. So someone is coming up with the policies, not because he's thinking about, maybe helping people who are actually suffering from health. I come from a community in Kisumu where almost 90% cannot access healthcare.
Yeah.
This brings me to another thing about access, because we were talking about leadership that focuses on strategic interest than impact.
Yes.
Another one is access. There is no access. You could be having a system. You've built hospitals, or you've built an insurance policy, for instance.
Yeah.
But people cannot access it. So, for instance, I'm talking to you about my community. A community where, for someone to get access, for instance, to a hospital, they have to walk almost like 3 kilometers.
Yeah.
To get access to a hospital, sometimes even 5 or even 7 kilometers.
Yeah.
So there's a problem also with accessing this healthcare. Another problem is about, stealing. I don't know how to put this, but Because this is a very big thing, you know.
And a sensitive matter as well.
This is a very sensitive matter,
Yes.
and I would love to say this, you know, to the government and even the citizens of this country. We really need to be careful about how we run our systems and how we think about systems. And I would love to, maybe, because we have not explained, we are talking about systems, but we have not explained that what are these systems.
Go for it.
You know, and I would love to explain system in a very simple way. Is that a system is simply something that will continue working even if you're not there. So, for instance, I could be Minister Radak. Let me say I have an organization.
Yeah.
All right. So I have an organization. I'm running it. I'm doing all the operations and all this. I'm running the organizations.
Yeah.
Let's say today I die, because you know God is the one who created us and he can take us anytime.
Absolutely.
Let me say I die today, and I did not set processes that can run when I'm not there. You know, the organization is going to crumble.
Yeah, it will die. Yeah.
So the systems, for instance, in our country, need a revolution where they can continue working independent of the people.
Of the people who are there. Absolutely.
You know,
I agree.
Independent of the people who are there. So, for instance, if you have a healthcare system, it's not like, for instance, what happened, and previously we were talking about this, what happened, with, for instance, with the NHIF and the SHA, that you just immediately cancel one and bring in the other.
Start another
I
one.
mean, it makes no sense.
It was a mess. Yeah.
It makes us, and it brings the country, you know, so much steps backward, and it also shows mediocrity.
And remember, this is we're talking about healthcare. This is the nerve center of any society. You know, for a society to thrive, people must be healthy. So if you are not able to access, because you've talked about accessibility, and I do agree with you, if we cannot access treatment for whatever reason, you know, not that you have not paid, you have paid, not that you do not have, you're not registered, you're registered, but because the system was not tested. So like I told you, my background was in technology.
Yes.
And when we're implementing systems, the first thing you do is you test the new one. And you test it and you know, you test, find bugs, unarekebisha. Test again, find more problems, unarekebisha. So that by the time you're implementing this one, you know that this one is 100%. But even still, you don't switch off one and washa nyingine. No, you do it gradually, so that as this one is tapering off, this one is taking off. So when we didn't do that, I think that was a failure on the part of the people who were, you know, supposed to run with this. However, I think now things have settled down, and the system is, should I say, because I remember the head of state saying, it still has some teething problems, but they're working on it. My hope is taking him at his word that this will be sorted out, so that we have a system that but can work. But yes, I don't know if you finished, but you know, just back to the barriers that you know, because we talked about accessibility, you've talked about when you put up systems for strategic interests, as opposed to having systems that are going to work to
create impact.
To create impact. Is there another barrier that you foresee, or that you've seen in your space? Yes,
another barrier is for the. I would love to push this now to the private sector,
right?
Because we don't have enough innovations, or even in terms support to these kind of innovations that will be able to build on healthcare. Because we understand the government is just an entity, and they cannot survive alone if we don't have private people who are private players. We need to have people like you, Mr. Ezekiel, who, you know, you are a background in tech. We need to have people who can even combine medicine and tech
and technology,
and then be able to even train the government. And through this, we can be able to even challenge the government. You know, if the government sees that there is someone who is really kicking it in the healthcare space, they love to keep up. You know, you cannot exist when there is a big guy who is existing. You'll have to join them in their camp, or you pull up your socks so that you. So we don't have you know, people in the private sector who are actually focused on building
On the innovation.
building healthcare, because even right now in terms of insurances, apart from SHA, the other players in the insurance field, the private
Players.
insurers, don't want to mention their names
Yes.
because it will be like,
Yeah.
but we don't have enough of support from them. Personally, as in business development in Ultra Diagnostic Center, it's been a big challenge even trying to get on board these insurances. And a lot of our patients have suffered for it.
Yeah.
Because you find that a patient has SHA, but as you know, SHA doesn't cover, by the way, everything. For instance, in terms of a test. Sometimes only if the institution is accredited they have an arrangement with SHA to cover everything, but most of these institutions can't. So sometimes you find that there is a need for another insurance to come in.
Right.
But then you find that these companies, they feel like they are going to go into a loss, for instance, if they work with different institutions. And that shows that there is no systems in there to support different health facilities. There is no, like the public. One thing is we cannot all depend on the government.
Yeah.
So as the citizens, we also need to think outside the box. We need, people who have gotten the privilege to maybe have some information, maybe who have studied. We need to have people who come up more with innovations and inventions that are going to take healthcare to the next level.
It goes back to there's this thing called public-private partnerships, and I think that's what you're alluding to. When government players and private sector players come together to build together. Because I look at advanced countries. I say this with a bit of please, whoever is watching, the fact checkers, don't crucify me. But the UK system used to work, the NHS. Okay, it's used, and I say used to, because they've also had a lot of teething problems, pro-Brexit and all these other things. But that their healthcare, and it's public healthcare, funded purely by taxpayers, and you would be able to access quality healthcare, care without. In fact, you go to private because you have decided to, but the NHS used to work. Up until I think Boris Johnson leadership. So for me, that is the ideal situation where you find the government systems really working. And again, when I think about a system like SHA, I think I want to extend a bit more grace because of the person at the helm, Dr. Mercy Mwangangi. She has really, I think during the COVID times, she showed what true leadership is. If we were able to get SHA to the place where the NHS used to be, or where it can be, then you see, Radak, we don't then need to go back to our private medical systems as a primary, because now very many people still go to private care as primary. I would look for a system where leo nikiwa mgonjwa, I go to the public dispensary down the road because I know I'm going to get good care. But as it is now, I know I won't. So what do? I go to the brand names that we don't want to. We're not endorsing anyone here today. But we go to those ones because you know for a fact that utendo upate matibabu no upate dawa. You will pay. Sometimes it is covered, sometimes not covered. Do we even have insurance to begin with? So you're paying for SHA, but you cannot get treatment. So you have to pay for another insurance. In those countries like the UK, and I think Canada also has a public. In fact, I want to say most of the advanced Commonwealth countries. Again, I stand to be corrected. Because umejua siku hizi bwana ChatGPT mtu ameshakwambia hapo umengoa. No, I stand to be corrected. But most of these countries, their public healthcare is free, and it is very good. That for me is where we would be.
I mean, it's a great dream, and I would love to just input something. Let these leaders who are steering the country know that we are in a big mess. Let me say, for instance, me or you, Ezekiel, or even the viewers, of course. In your family, or in your house, if you cannot be able to, if not everyone is healthy in that family, then that is a tragedy. Irrespective of how much you have in bank account, irrespective of how much of a spectacle you put in football. If someone is sick in that family, even that football is not going to be played.
It's not going to help.
you know. So let's look at Kenya as our family.
Yeah.
And I really plead with our leaders, let's look at Kenya as our family.
Yeah.
If healthcare is not working, then we do not have even an opportunity, a reason, or even God's support to enjoy anything in terms of spectacles or even parties. Talking about parties, you know, in Nairobi, and people are you know, we really need to look at this in such a way, you know, with compassion, please. Yes, you know, with healthcare, I usually say that let's not look at healthcare just as a responsibility. Let's look at it as with compassion a little bit, you know, because some of these leaders have not traveled. They have not really seen what people are going through. You know, recently, I won't mention names, but recently I was just handling a case, you know, in my circle where I met a patient who cannot be able to excrete, especially, you know, the short call. They cannot be able to urinate through. They don't have a urinating system. So the urine comes through the second option that we usually have. And this guy has gone through a lot of pain.
That is
and
a lot to think about.
And not just pain in terms of, you know, the physical pain, but even mental pain,
emotional and psychological as well.
Because you can't be above 15 years and you still want to walk with Pampers. This is crazy. And you, leader, think if this was your son. And this is something that has a solution. You know, the patient, the guy can be able to be put for, you know, like a urine bag or something that can be able to help.
A catheter.
And not just this, walk into the streets of Nairobi, brother. You'll see a lot of people who are emaciated in the streets and they are begging. While we have people who are running around with, you know, with fuel guzzlers and all this, we need to look at this with compassion. I don't want to go so much deep in this because sometimes, you know. All right.
No, but you see, what you say makes a lot of sense. If we build systems to serve the people, and not to serve our personal interest, then we have a wealthy nation. And when you have that wealthy nation, you are able then to expand, to grow. You cannot want to be a first world country with ailing population.
Exactly.
Who's going to work?
It makes no sense.
Huyo mtu wa mjengo mwenye anajenga, if he's unable to go and access cover immediately when he's unwell, then what's going to happen to the work that he's doing? It's gonna fail. So we must, you know, healthcare, check. Education, check. Sasa we start now building. But you know, when we're getting independence, we said that we have three enemies. The first one was ignorance. Of course, I started as a list and then I've forgotten. But if we are unable to take care of the basic things, hunger, you know, healthcare, primary healthcare, you know, forget even now moving to the more advanced things, then for me, whatever vision that I have as a leader is dead on arrival, because people can't think properly. If you're sick, you can't work, you can't do anything. So I really like what you said. Without that system, you know, it is just not going to work. You're here on Money Mondays. This is Ezekiel Olande with Minister Radak Sammy. We are talking about building a healthy healthcare system in this country, and you know, just trying to look at what is ailing our country, because if you are not healthy, that's it. Just, you know, we were supposed to have had this show last week. I was unwell, could not happen.
Look at that.
Yeah, it's just, you know, as simple as that. If you're not really looking at healthcare, my friend, you have nothing. Anyway, you've touched on the private public's question that I was going to ask. So let me move to the next question and ask: do you believe that Kenya's healthcare priorities align with long-term social and economic transformation, our current policies?
That's a big no.
That's why I smiled before he answered the question, because I knew Radak's answer.
That's a big no, because how old is Sha?
I want to say 2 years.
Look at that.
Yeah.
2 years, and already we see big problems with it.
Yeah.
You know? And not long before this,
Yeah.
there was the scandal of e-citizen, where a huge amount of money was lost.
Yeah.
So, I mean, if you look at it, going to what we talked about, strategic interests, and I would really love to, this is advice, and I will advise the government, even if you do not pay me.
Angalia hapo kwa
I will
mtandao,
advise
waambie.
you that, you know, if you want to sweep your compound, you must get ready to be dirty. You know?
Yeah, true.
So don't look at creating, you know, big image or seeking global influence before you sweep your compound. You can't be clean, you know, outside and your house is smelling.
Yeah. Yeah.
You know? And only after the government or even the larger population of this country understanding this will be able to will we be able to build systems that will be long lasting.
Yeah.
And by doing this, it means that we should be ready to even forgo that opportunity to, because I know sometimes there's an opportunity where you say, I have an opportunity to make it big.
Yes.
You know, yes, I only am in this ministry for only, I don't know, with now the Gen Zs.
When
with the Gen Zs,
umechomolewa.
with the Gen Zs, I may go even after 3 months. So don't look at that.
Yeah.
But look at this, you know, in terms of what you're building for the next generation.
Yeah.
And trust you me, the world has a way to recognize you and to pay you for the things that you'll do.
Yeah.
You know, and you may be chasing money, and this will make me go even deeper into talking about what money is. Everyone is chasing, you know, to make it big, but you know, money is an invention. Was invented by the so-called Augustus Caesar. You know, and that's why they usually say, pay what belongs to Caesar. To Caesar. Because these are the people that invented money. And then after that, you know, it's been to subject to different manipulations, where also the United States have also had their part of, their bit of manipulating the currencies to make sure that whatever you
uses
do,
the dollar.
Everyone uses the dollar. So whatever thing you are doing, it will go back to them.
Yeah.
And even here in this country, there's been a manipulation in the currency. I saw, I think 2 years ago, when they wanted to change these new notes to newer notes, just because of a signature of the governor of a central bank.
Yes.
You know,
we unaangalianga your signature.
Do I even
know?
Do I even care about a signature?
Yeah.
So basically, you know, money is an invention. And look at people who have really tried to, you know, make it big in terms of money without real-time impact. They always crash.
Yeah.
And, you know, one thing is that, and this is really deep, one thing is that all of us, you know, will die someday.
Yep.
You know, I know this is sad to hear, Mr. you know, government, but all of us will die someday.
Yeah.
And what will you be leaving behind?
What is your legacy?
What is the legacy that you're leaving behind?
Yeah.
I mean, so we should focus on building systems that will be able to help generations after we are gone. And through this, trust you me, you'll make it. And I would love to relate it with, even if someone has a business idea, in terms of those people who are in innovation or people who are proprietors of businesses.
Yeah.
If you focus on making money with your business, you are going to crash before you rise. But if you focus on creating a solution to your customer, to the end user,
Absolutely.
your business is going to grow.
It's going to grow. Yeah.
You know, so
you're meeting a need.
Yeah,
Yeah.
you're meeting a need. So even as a government official, if you focus on making something for yourself, you are going to crumble. But if you focus on building something impactful,
Yes.
then everyone is going to rise. And you are going to rise even, you know, your rise is going to be even compound.
Yeah. Yeah.
All right. And, you know, I don't want to be personal here, but look at, for instance, if you want to know that there is a problem, look at, for instance, there is a latest investor in town who is investing in matatus in town. According to you, you know that investor. Do you think with the profile
Yes.
with the profile where he's coming from, do you think that is the investment that he needs to do?
I will not get into that.
There are bigger
but
things to look
I
at.
hear you 100%.
You know,
Yes.
so it shows that there is like a gap. There is like a gap, because those things, they create nothing but chaos in town. Of course, there are some people who love it. Yeah, of course, you are trying to create that environment for them, but it shows that we cannot think, you know, so much above.
Yeah.
Because they are the only need that is being, because me, I'm a business person, so I look at, if you create a business, what problem are you solving?
Are you solving? Yes.
Maybe the problem they're solving is that people are not entertained more. And entertainment is not bad.
Yeah.
But sometimes it's not what we need. You know, as we were talking, we were saying before that, you know, if you are focusing on, you know, creating spectacles or what, when your kids have not even eaten, then you are crazy in your mind. You are not all right.
Yes, I agree.
You know, you need to focus on things that matter. And sometimes, maybe, you know, one thing is that, and in leadership, I think people in leadership need to understand this, that it's not just about doing the things that people love, but doing the things that people, even if they don't yet love it, in fact, they may hate it, but in future, they are going to love you for putting them through that.
So you're not people pleasing.
Yeah.
Yes, unless
Exactly.
you know, what you're doing is actually for their benefits.
Yes.
Yes. And I think sometimes also we find ourselves in that space where you want to be a populist.
Exactly.
And come up with populist ideology, but are these ideologies going to hold water down the road? You know, so I can make a declaration here and say all manner of things, but are you going to back them up with statistics, numbers, facts, and figures, or hot air, as we had in the Supreme Court ruling? We need to move. We are not talking about politics. We're talking about healthcare. Radak is a governance enthusiast. Actually, I would call him a governance specialist. That is how we met. I was conducting a training that he was a participant of, and
he's a big trainer. Look for him. Look for him.
I'm not endorsing myself, but you've had from Radak. Anyway, let's get into business and leadership in health. So what role should business leaders play in strengthening a health system beyond CSR initiatives?
All right. So one, I think we've a little bit touched on this in different aspects. But I usually respect business leaders because I think there is no challenges you can go through than being a business leader, brother.
True.
Business is hard, and especially in a country like Kenya.
Ground, it's called character development.
Business is really hard. So first, I have to congratulate the people who, you know, have said, you know, have invested their time to say that they are going to be in business. But still, I would love to insist on the same things we were talking about, impact.
Yeah.
Number one is impact. Always focus on impact.
Very, very important.
Forget about anything that forget about anything that you'll have in return.
The photo ops and the branding. This was done by Minister Radak. Yeah? Unaenda unazindua. Let me just
go back. Say it.
But I saw someone launching desks. You know, I asked myself, okay, did we need all of this for you to launch desks? What is... Anyway, impact. You're talking about impact. We're talking about strengthening healthcare systems beyond CSR initiatives. And you say, look at impact. Continue.
Looking at impact.
Yeah.
Because this is going to make sure that your organization has a meaning, you know?
Yeah.
And another thing that can be connected to impact is sustainability. I mean, how long can this go? You know, how long can this go for? How many people can this impact? And this also relates to scalability.
Yes.
Because if you don't focus on impact, if you focus, for instance, on some specific, let me say, for instance, you have a company, you have only 10 employees, and you're looking to go to maybe 1,000.
Yeah.
You need to be able to amplify your impact to reach more people that could be served by 1,000 people.
Yes.
So it still goes back to impact. So if you're looking to grow, it's impact.
Yeah.
And this is good because, when businesses grow, the government even has more opportunities, to generate, for instance, taxes, like, the business taxes and all that. Another thing that I would love to, to put through to the business leaders is to be able to cooperate with the government.
Yeah.
And when I talk about cooperation, I really need to separate it from, some people think about cooperation in terms of, getting preferential treatment from the government. Or maybe if there is something that is coming from the government for them to get, exponentially higher than what they need to get. No, I'm not talking about that. I'm talking about the fact that, when businesses, really work well with the government, they can create a bigger impact. Look at, for instance, one of the biggest telecommunication companies in Kenya. They've really been able to create a good impact in the company to a point that the government decide to buy shares in it. This is an example of what can happen if businesses cooperate with the government and they have a common agenda. Of course, all these companies have their problems, but I would love to point that out. That is a good thing that, and we can learn something from that company by the fact that even though, the leadership changes, nothing really changes. The impact still continues. It's still scaling. It's still sustainable. This is something that I would love to push to the business leaders. Look at sustainability in that direction. You are going to be able to create, sustainability impact. Looking at the people, it is the biggest thing you can ever think about. The people, and when you do that, everything just aligns. And for the government, it's very hard. The government sometimes is very hard to advise the government. And that's why last year we took it to the streets on 25th June. Dear government, it was not, we were not fighting, it was advice. We were advising. It was just advice. We were advising you, do this.
You've reminded me of that guy. The people may. Keyword may. Continue.
I know there are some people whose job was taken away, but it is because it is because of the cause that you chose to support. It is because you stayed silent when there were some punitive policies that were being taken to the people. And you chose to stay silent. We never saw any of you, coming out and saying that, to be sincere, I've seen this and this is not wrong. This could also be, it could also be because of ignorance. We cannot, we cannot understand your ignorance. You can't be in a position, you can't be in a leadership of governance, and then you're saying you do not understand a specific bill.
Trust Radak to offer an olive branch and redact it in the same sentence at a bill, without even breathing in and breathing out.
I didn't say that we understand. Maybe they didn't know that this. How can't you know?
You're paid to legislate with they have, and that's why we give them research assistants to help them do this. Back to CSR. And impact. I like your thought process, because when you're thinking about something that is sustainable, because today we say we are going to put up a dispensary in Nyalenda. And we make fanfare about it. Menda mezindua, you've done all these things, but you have not equipped the laboratory. You have not partnered, with the local government. Because health is a devolved function. You have not properly partnered with the Ministry of Health, both at that level and even at national level. Then what happens tomorrow? People are excited, then they come, hakuna madawa. You have not really thought about your logistics or your value chain, how you're getting things done. What is going to happen? It becomes a big
chaos. Sometimes even problems may appear there. Maybe you have unqualified professionals, but because they were not vetted, you know, and that is now where Morara comes to inject. Nakuja nasema hii mulifanya, and you didn't follow up. But I do agree. Impact, and more so
sustainable impact. When you think about CSR, and we're thinking more on the, space of healthcare.
Yes.
If you're going to do something, do it well and do it for the long term.
Yes.
Like you said, systems that outlast or outlive people.
Yes.
So
And people centric. I mean,
yes,
it should be focused on the the end user, the person who is
yes,
actually
yes,
accessing,
yes.
needing this service.
Who needs the service. Absolutely. Well said. How do you balance the tension and between business sustainability and social responsibility in healthcare?
This now requires people who have taken some time, in business. And I pray for all the businesses, all the business leaders, all the businesses in Kenya, to go to a point where, they're sustainable, they're serving customers. But then for you to be able to move from that level of sustainability to actually create real-time impact, because sometimes your business can be sustainable because maybe you have balanced your account in terms of finances, you've balanced your account in terms of your partnerships are working and this and this and this, you are safe. But then sometimes maybe this is not directly reflecting to the end user, who is the customer. And we are here. Let me say, for instance, you have a healthcare system. Maybe let me say you have a big hospital. For instance, I won't mention names, but there are some hospitals which, when we look at them, we can say these hospitals are sustainable. They are moving well. They have good branding. They have good, good positioning in the market and all this. But you may find that they are too expensive for some patients to access. So it all goes back to looking at the long-term impact. Long-term impact that you're trying to create. Maybe you just want to serve a certain class of people, but this will mean that they'll be still, not good over image of this healthcare facility, for instance. So you need to kind of create availability. You create an opportunity for those people who cannot reach that kind of class
to
be able to
access your
services. Your services.
Yes,
and this is going to help you in a broad way to achieve such goals. Yes.
I like that.
And also another thing is looking at we have to appreciate, for instance, the SDGs, because sometimes they guide.
Yes.
For instance, if so you have an organization not just because you are trying to make money, but because you are trying to achieve like
one of the goals.
One of the goals. Let me say, for instance, it's good healthcare. So you are not just there because of not just there because of business, but you are there because you have a bigger mission. And the bigger the mission, the bigger your scale, and the bigger your ability to be sustainable.
And just quickly touching on the SDGs, I know universal healthcare is one of them. Accessing that, and within that, I think is also to do with reducing maternal mortality rates within in whichever space you. And so we had the Vision 2030. I think we are still on course to getting it, and some of the SDGs or some of our, these things align. And so if we want to achieve universal, and I think it's universal primary healthcare, and if you want to reduce the the infant mortality rate, the maternal mortality rate, because, it's very sad. I worked at a project once, and they were working in this space within healthcare. And the statistics were being given about the maternal mortality rate, for instance, in Kenya, were very shocking. And more shocking was that countries that should be behind us were winning at taking care of mothers after they deliver than Kenya, which ideally should be more advanced. So again, back to what you have said, when you have a bigger goal in mind and you're working towards that, then you are able to get the systems rallying behind you and getting this thing done right.
Yeah.
Good stuff. Tunaingia kwa upande wa technology.
You
know,
and that's your interest. I see you smiling.
Of course. So of course, Radak and I were talking about this prior to the show. But maybe let me ask you this: what technologies, in your opinion, hold the most promise for creating more resilient, affordable, and transparent healthcare systems?
Yeah. Okay. So one will be, right now we thank God for the, upsurge in technology, which has made things easier.
Yeah.
And I would love to, of course, say that this has already started changing and impacting healthcare. Where, for instance, in terms of research, it's easy to research new infections, and it's easy to reach, for instance, analysis of certain, certain conditions maybe that a person is having. Some of the good systems that I'm seeing is improved security systems, and I would love to start with security.
That's a very good place to start with.
So, I mean, technology should really help in terms of strengthening the systems.
Yes.
And one of the ways is by making everything public, for instance. Let me say, for instance, there's something happening in a ministry in terms of government. All the finances, all the, all the listings should be able to be visible to anyone through technology.
Yeah.
There should be systems which can easily, better, but I think there should be systems which can easily establish ways of detecting, for instance, fraud or inconsistencies in books, for instance.
Yes.
And if there is none, then that is a call to the technology,
Ministry of ICT
out there, and especially Ministry of ICT. I have seen some a little bit of blogging against
No, but just touching on security and using technology, I do agree. If we have systems, even just patient information, are they secure? And if they're not, what is happening? Because if I'm able to download let's say patient information from, let's say, Ministry of Health, or forget health, ministry, whichever ministry or business,
or from a hospital website,
and publish this information, that you can really compromise a lot of things, because healthcare information is supposed to be private. So very true. We need to ensure that there's security, and what you're saying, transparency as well, because technology allows you to ensure that systems are transparent enough to detect whenever there is something and report and mitigate. What about artificial intelligence? How has it affected your industry?
Actually, is the next thing that I wanted to say, that maybe we can, because some of the things that we can do to improve these systems is through technology, is by integrating AI in a good way.
Yes.
And I really have to insist on this, because I am really afraid of AI, by the way. And
one day the robots will take over the world.
I'm really, if you're someone who sometimes, can, because look at, for instance, what the world has been able to achieve at this moment.
Yes, and the speed at which we've been able to achieve it.
And that speed,
yes,
that speed is crazy. And when you are at such level and then you lose control, the results are going
crash
to be,
and burn, and the crash will be big.
It's going to be so bad. It's going to be so bad. So that's why I have to talk about this, in a very, we have to protect ourselves, and AI is beautiful. We thank God for AI, because at the end of the day, everything, was created by God. And AI, I remember, I don't know the meaning of this. I don't know the authenticity of this video, but I saw a certain video, I think through NASA or something, when talking about the Area 51 in the US, where a certain robot was captured, alien was captured.
Right.
And then this alien was being interviewed, and then was told that, and then it says that there is a destruction that is coming. I don't know if it was a movie. There's a distraction that is coming.
It sounds like a plot for a good movie.
A distraction is coming, and then these guys were asking me, "What do you mean? What are you talking about?" And then it says artificial intelligence, and then it said, and then they asked him, "What about artificial intelligence? When is it coming?" It said that sooner than you think, and you are going to be surprised. That is what the alien said. And then, okay, even if it was a movie or even if it wasn't,
yes,
I mean, this is a projections that, if you think about it.
Yes.
Let me say, for instance, if you are driving your car, if you are driving, that's why there's a speed limit of 80 in Kenya. If you are driving your car at 150, it means that at any point you could lose control. All right.
Yeah.
So we need to be careful. I don't want to spread fear for people concerning AI, because AI has helped. And this is some of the ways that it has helped. Because right now we see different healthcare institutions creating their, health registries, which through AI. So you can easily, for instance, search, you can easily reduce your search time, for instance, of a certain specific data to seconds.
Yes.
Let's say a patient has been sent maybe in a hospital that has integrated AI. A patient has been sent maybe from the laboratory department to maybe consultation.
Yeah.
Instead of having to walk or having to log into a website, then going to laboratory. This thing has been, it has been simplified. So the results are there with the doctor at that point. It has been simplified in terms of even diagnostics. And this is one of the directions that Ultra Diagnostic Center is looking to go in. Of course, there are some players who have already gone so big in this AI, including, having machines like PET scans, which are used in diagnosing cancer. And AI has really helped in automating some specific things. So there is like something, for instance, to detect tumors. AI can easily point to you that this is a potential tumor. So the work of the doctor is to just easily see that are they legit, or maybe the AI was confused or something. So it has really streamlined that process. And AI can also help in terms of security. Again, of course, we talked about security, but it can help in security when we develop robots that can be programmed to do a certain thing.
Yes.
You see, if we can be able to reach a point where we can have traffic police which are robots, then we cannot have policemen taking 50 bob or 100 bob on the road. Because, when the robot has been programmed that if this and this and this is not okay, then,
you just do what you need to do.
Yeah, you just do what you need to do. But, because we have humans, now, they go and sit with the driver this way and then... Right, so we can use AI in a very good way to develop good programs that can be able to help push the country forward. In healthcare, I've talked about in governance, and also I've talked about also research.
Yes, very
and
important.
Also in terms of education. And it will be really good because right now AI is everywhere. But I see in schools still, they are limiting using AI. What they should do, they should teach using AI in a now in a more streamlined manner.
I like how you're thinking.
Because the more you are telling these people, the more you are telling this, don't.
Of course they will,
but they still will. And that's how now they are going to do it badly. I remember I was being taught with my mother that for instance, if you have a young girl and maybe you are trying to teach her how to contain herself, not engage in adult stuff before time. If you literally teach her that, you are going to be able to help her. But if you're just aggressive and say, hey, you're creating more, right? So if we can look at AI in that direction, we embrace it and channel it in the correct way, because it's there. I think in those ways, and also more that we could be able to maybe...
Absolutely. Unfortunately, we are running out of time.
Oh my God. I feel like it's when I want to start.
Ndio ndege na imefika cruising altitude. No, Njagi atazima stima. So, to avoid that, I think I'll just invite you to think about your closing statement. But just picking up from where you have left in terms of use of technology, I do agree with you. We need to embrace it, but embrace it ethically as well, because we do not want to find ourselves. I was telling you earlier, forget just AI, just technology. When you go to see a doctor, for instance, you want this kind of interaction. You don't want this kind of interaction. Unaongea na yeye and they're just here. I think in medicine, there's still that human touch is very important. I have heard and seen videos of remote surgeries being done. That is a very good way of using technology, because you have a specialist in India, you have a patient here. All you need is a solid internet connection and the right equipment and theater, and he's not instructing, he's actually doing the surgery from wherever he is. So that is a good use of technology. But technology in healthcare should be used very carefully, because it can also lead to a lot of malpractice or things that are just
and I would love
poorly.
to put it simply that let's use AI or technology as a messenger, but not as a brain.
Yes.
Yes. Let us not let technology do the thinking for us. Do the thinking, and then when you need a messenger to handle, the tasks like now just sending, or taking things from point A to point B, then you can use technology now, but don't let it do the thinking.
Yes, I agree. So, final thoughts as we wind this conversation. I believe we will have more conversations in the near future. But your parting shots. I want you to look at that camera and tell us what you think, what your take home is from this, in terms of healthcare, in terms of governance, and in terms of systems, and how to strengthen them.
I love to first, thank you, Ezekiel, for even, thinking in this direction. And even as Mahatma Gandhi said in the direction of healthcare, that prevention is the greatest, but where you cannot prevent, once the diagnosis is twice the treatment. So we have diagnosed not just healthcare discussions, but even broader discussions like business and governance. So we've kind of diagnosed some of the directions that maybe there are problems, or in the direction. And actually, the best thing that we've done, and what is my takeaway, is we've talked about systems. And it has taught me that we really need to embrace systems of thought. All right. And if you look at all the great men in history, the biggest things that they did was creating a system of thought, so that even if they're not there, there's a leader who will just come up saying that, I want to be like Martin Luther King, because he created a system of thought. And that is living even when he is not there. And that has taught me that if we can be able to lift up, more of people who have these conversations, or think in such a manner as you think, Mr. Ezekiel, we can be able, look at the impact we can be able to create, let's say, for instance, in a period of 3 years. We will have altered history. And I would love to, to thank us, the Gen Zs, for, coming up, last year to do the God's work. And we have told people that, to be sincere, everyone was suffering, but no one was open to say that.
No one had the sense to do something
to
about it.
Agitate for this.
Yes.
And now we've seen at least Gen Zs can be able to create a certain form of change. So if we can be able to change that system of thought, look at what we can be able to achieve. And similarly, this is the same thing that we need to do in the healthcare systems, business systems, and governance systems. And what I've insisted on today is impact, focusing on real-time impact, not just making money, not just creating spectacles and looking at the next election, not just, for instance, showing people that you can do this. Make sure that you are looking at impact. And apologies to people of other faith, but I would love to talk about something that I learned from the Prophet Muhammad, peace be upon him, that on the day of judgment, there are different people that will go in front of God. One will be a rich man, one will be a martyr who died, talking about God. Another one will be someone who had a lot of knowledge. All right. So you were doing this, but then you were doing it. So God will ask them, why were you doing it? I was doing it because you blessed me with this and I was doing it for you. And God will tell them, you are a liar. You did it only for people to praise you, but you didn't do it for me. And they will be taken to the fire. And I draw this story and tell myself that if you are doing whatever you are doing, if it's leadership, if it's you are creating a business, if it should be not focused on you getting all the glory and honor. It shouldn't be about you getting just the money, but it should be of real impact. And through that, fortune will just have a way to repay you. It will just have a way. If maybe you're looking to grow big, you are going to be able to scale your business and you'll reach that level. So if only our people will be able to think in that direction, we could alter the system of thought in our country and alter how the systems run. And we are going to create better generational systems. Yeah.
Wow, you had it directly from Minister Radak Sammy from Ultra Diagnostic Center, just giving us his passionate appeal on building healthcare systems that are beyond the immediate and thinking about sustainability, thinking about impact, thinking about service to man, not service to self. And I think that for me really drives it home, because if we're able to look beyond ourselves and just ensure that our healthcare system is healthy, because health is wealth. We've said this times without number just in this episode, and I'm sure it's not an original thought. When we build healthy systems, we have a wealthy system. And for the country to grow and to reach those heights that we're thinking about, first world status, we must start with the basics. The healthcare system must be healthy. The governance around the healthcare system must be done well. And businesses as well must do their part to ensure that we are running a healthy system. From me, Ezekiel Olande and Radak Sammy, we say thank you for joining us this evening. If you have any questions, please feel free to reach out to us. Radak, you didn't give us your socials. If you want to reach you, takupata aje?
Yeah, of course. When we talk about building systems that are not serving self,
yes,
I have to separate it from marketing myself. Because if I...
you see, he's not just preaching wine and drinking water. No, he's doing the thing.
Yeah, so only after giving me an opportunity is when I can talk about where you can find me.
Yeah.
So I would love to also first say that I work with Ultra Diagnostic Center, which is the latest disruptive laboratory and radiology center, which is located in Kilimani Adams Arcade. We do all the services in terms of lab and radiology, and where you're seeking maybe intervention in terms of that direction, we'll be willing to help. For me, I have a passion to create the next generation. I have a passion to make sure that I empower impact in healthcare, business, and governance. I think that this is some of the problems that we've been suffering from. And, they say that culture will eat strategy for breakfast. So however good strategy you have, if you have a bad culture, then you're not going to survive. So I'm trying to build, that is what I'm trying to do. I'm trying to build a better culture for the next generation that will be there even if I'm not there. So if you want to, be part of this work, you can follow me on especially LinkedIn. You can start with LinkedIn or X, Minister Radak Sammy. If you just search Radak Sammy or Adam it will mean minister there, you'll be able to find me, and then you can be able to catch up. You can also check Radak Foundation pages, because I'm also building Radak Foundation, which I'm using to create impact, especially for in rural areas who cannot be able to access such spaces or technology. So I'm creating impact in those areas to be able to build them with capacities to be able to be even better leaders for the next generation.
Good stuff. And as always, we are on Icon Radio on all channels at Ezekiel Olande or Ezekiel.Olande in all socials as well. Hit us up. Let us know what you think about this conversation. And if you have questions or you want us to continue this conversation, let us know. But from now, kudos to Mr. Njagi, my producer. Good night, good evening, good morning, depending on the time that you're watching. Kwaheri sana.
But I think I should check you, Ezekiel, and then I give you a good following, all right?
Bas, ndo hiyo. All right, we're out.